In the age of anti-intellectualism, Cheyenne Bryant is a case study on why professionals should be, well, professional. When you meet a licensed clinician, whether they are associate licensed or they are fully licensed or independently licensed, you are meeting someone who has gone through rigorous amounts of schooling, supervision hours, and testing in order to be where they are. In my field of study, if you want to gain your associate's license, you have to have a master's degree, and then you have to take the national exam. Then in order to be independently licensed, meaning you can own your own practice without supervision, you are required to do at least 3 years of work experience. So you have to have somewhere between 2,000 to 3,000 hours, depending on the state. You have to undergo 250 to some states 300 or 350 hours of supervision, meaning that you are meeting and practicing under another licensed clinician. Then you take the national exam. Just the application process alone requires references. It requires proof that you did these hours. The board has to approve it, do a background check, make sure you're in good standing, and then you get your license. This is not because it is the best way to find the best therapist, right? But it is one way. It is one way to ensure that the quality of the therapist sitting in front of you has been tested, has been tried in some form or fashion. Having a license is the most ethical and the only safeguard that we have to serve you, the client. If you have a clinician who is unlicensed, they are not held to any ethics or standards. If they harm you, if you are not experiencing the best quality of care, you are essentially left in the dark to figure it out on your own. I know that we are in an age that says that people don't have to go to school in order to know all of the things. That may be true, but do you want to trust your doctor to do surgery on you or to treat you with medication without having gone through rigorous testing, knowledge, and understanding to ensure that their treatment plan is the best for you? Therapists are healthcare professionals, despite how we get treated. And you want to think about your therapy experience the same way that you do a doctor. You want to know that the person sitting in front of you actually knows what they're doing, or at least can prove it on paper. Unfortunately, Cheyenne Bryant does not pass that test. And I understand that there are clinicians that are looking to forego licensure. That's their prerogative. But me personally, I like to know that I not only have a board that protects my clients, but a board that protects me, especially when I know that I'm doing the right thing in any context. Licensure doesn't just protect you, it protects me and it protects the field in general. So let's stop supporting people who don't want to be ethically, morally, and professionally responsible for the work that they do.